Good evening, everyone. Welcome to another edition of The Gray Area here on the Black Man Unfiltered Network, simulcasting on the Sparta HQ Network. I am Mr. Bennett, joined by my partner as always.
This is Sparta!
The Ghost of Sparta, a.k.a. Peter, the a.k.a. Paniotis. Yasu, my brother, what's going on?
What is going on, my man? How are you tonight?
Well, I feel a little bit better. The Steelers finally won today, so I feel a little bit better about that. But yeah, feeling pretty good overall.
Don't rub it in.
I'm not trying to rub it in. I thought Tyrod Taylor that he did a good job today. Just couldn't finish it today. But Jets they're in every game, and so certainly once they get a little bit healthy, they should be fine. But yeah, just starting to prep. Again, we're going out of the country next week, and so starting to get those final preparations in. I got some work assignments I need to finish before I leave, so I'll probably be up even after our show tonight. I'll probably be up still doing some things work related, just going into Monday, and just making sure that I can leave on a good note and not have a pile of work on my plate when I come back. So just just getting some things in order, and looking forward to it. And it's interesting that our show topic tonight. At first, I got a little confused in this. I thought we were going to talk about energy, but we're talking about healthcare tonight. So I was putting some things together for the discussion tonight. And we're going to be going to visit my daughter who's in medical school. And, so certainly she has an exam this coming Thursday. So we get there Wednesday. I probably won't even see it at least until Thursday night because, just preparing for the test and then, recovering from that, they don't give you a lot of time off. So it'll be sporadic when we do see her down there.
Studying abroad is a whole different animal than over here.
Mm-hmm.
Because I talk to my friends who study in Greece and they nail you one after one after one after one. It's like literally you get you're in a round with Tyson and like trying to dodge punches and like shit and like can't get enough here and like it's not. Let me ask you a question. How you guys keep contact with her when she's overseas?
WhatsApp, pretty much. I mean, texting is still free. I mean, phones. If she tries to call us, then I didn't sign her up for an international plan through our provider, but WhatsApp is pretty much free. She's in Wi-Fi areas most of the time, so she can even if she called us, she can call us on Wi-Fi. She doesn't have her mobile service turned on, so we get around it pretty well. But a lot of times she'll hit me up as I'm driving home from work. She'll hit me up on a WhatsApp video chat and whatnot. So she so we communicate pretty good. And
because if you remember our guest who comes on the Hangout and the Spartan Arena on the Spartan Industry Network, Greg, he's in the UK. He when we exchange information, just keep contact with the guys and everything. Is he first thing he asked me, you got WhatsApp? Everybody uses WhatsApp overseas.
Yeah, no, it definitely saves you a lot. You don't have to worry about getting international phone plans or whatnot, because we were all kind of contemplating that before she left, but yeah, WhatsApp is working very nicely over there. She also has a VPN.
My experience with people going overseas or traveling a lot, T-Mobile has the best international plan out there right now, because it's like $10 and shit like that. It's not a lot actually. To add is unlimited text and talk and FaceTime and all that.
Well, for us, we actually did that last year. I think it was actually $30 for us. $30. Yeah, we went on a cruise. We went on a cruise in the Caribbean. It was $30 for like unlimited talk and text and whatnot, and also data. We also got some data when we were down there as well. So again, but you basically sign up for it so that one time, and then when you come back, you take it off. So we were thinking about that initially for her, but so far we haven't had to do that. And
also
so
the
far
other
it's
option
working out.
is get a virtual SIM card is called, and you get it's like a prepaid card. You get minutes as
Yep.
That's the other option. The virtual.
We contemplated that as well. So so certainly all those options are on the yeah. So I mean all those options are on the table, because we went to T-Mobile. And they were talking about that as well, and certainly some of the folks who are there, they're from the Caribbean and Latin America, and so they were talking about those prepays as you were talking about as well, that you can constantly sort of add on to. That's another way to do it as well. But so far, like I said, WhatsApp is working pretty nicely, and and like I said, we'll be able to see her we'll be able to see her next week. Shout out to Braxton, the Steak Fiend, in the building tonight. Just for anyone who's coming in tonight, make sure you hit the like button as you come in. Again, go over to Sparta HQ Network, hit the like button over there as well. Certainly appreciate you guys being here, and certainly if you guys, certainly appreciate the content, consider dropping a Cash App or a Super Chat to the Black Man Unfiltered Network, or certainly anything that you want to give us personally. You have streaming at the bottom here. We have our own individual Cash App. So again, we appreciate any support that you would give us. And so we're going to get into this tonight. And again, this can, this conversation, because we had some big hitters. So I know the few shows we were doing recently, we were dealing with more personal stuff. Now we're kind of getting more into the big picture, more some of the global issues. So one, we're talking about healthcare tonight, and then in the upcoming show, we're going to be talking about energy production. In another one, when I was, I already started preparing the decks for that, and I had so many slides, I kind of have to try to narrow it down because there's so many perspectives you can take that in. And, so again, we're going to, keep the conversation more so focused on, I guess, the systems themselves, where I don't necessarily want this conversation to go, because, again, I know there's a lot of political, stirrings that when it comes to this. So, again, we're trying to keep it out of the political space, per se, if we can. But they say everything is political, so I don't know how far we can do that. But, we want to be able to talk about it from the standpoint from a global a perspective in terms of who's providing health care, and healthcare costs and whatnot. And then even to the point where it's more personal for us, because I know one thing me and Peter had shared was that certainly, healthcare was a big factor for us when it came to our parents. I know, certainly Peter's mom still taking care of her, and she's in the healthcare system. I had to take care of both my parents when they were in the healthcare system. And, up to this point, neither, my wife and I, were relatively healthy. So we don't have a lot of interactions with it. I try to go every year and get my checkups every year. I had my colonoscopy when I turned 50, and I'm good for 10 years on that. So, so you're doing the business of, really trying to have health care, or it's to stay healthy rather than sickness. And one of the things that that unfortunately what tends to happen is we focus so much on treating sickness rather than treating health or promoting a more healthy lifestyle, so you don't have to stay in the healthcare system. But Pete, you want to say something?
Yeah, well, I was going to ask you a question, because with the healthcare, this is always a great area with me. When it comes to fitness, like say a DEXA scan, for example, would your insurance cover that, you think?
I'm sorry, for what particular
DEXA scan? Familiar with what a DEXA scan is?
No, it might be another term. Which one?
DEXA scan is pretty much this really high, very accurate machine to measure BMI, pretty much your fat intake.
Okay.
You know what I'm talking about now, right?
Yeah. I don't think it's covered by insurance, which is again, it's one of the things with healthcare coverage. They don't pay as much, to treat you well. I mean, like my dental plan, for example, they'll cover 2 cleanings per year. Every 6 months I go for cleanings. But as far, and certainly if you get any kind of vaccinations, at least up to this point, I'm still covered whenever I go for vaccinations. But anything that's sort of, really health related, and everything from, although I do know a couple plans, I know one of the plans at my job, they do give you some sort of waiver for gym membership. So if you want to go and join the gym or whatnot, I think they cover at least up to a certain amount of some of your gym membership fees if you decide to go, but it's only at some select gyms of their choosing.
That I do want more corporate gyms, like say Retro or Snap Fitness, those big corporation gyms, not like the mom and pop place like I go to Muscle Inc., for example. That is a little different story. You. But I'm actually curious about the DEXA scan, because I actually am thinking about getting one very soon, to be honest.
Yeah.
Because I was talking to a bunch of trainers out at my gym, and they said to me, we could do the BMI, but it's so off accurate anymore.
Yeah, BMI really doesn't factor in lean muscle mass. Like I'm basically, according to BMI, I'm obese. According to BMI. So again, it really doesn't factor that in. So you really have to be what your lifestyle is, what your activities are. I mean, if you're a football player or something like that, you're a high level athlete, BMI is going to be relatively useless to you in the grand scheme of things. But it's interesting just getting into this healthcare discussion because, again, unfortunately, sometimes BMI is used when they're doing an assessment of your health overall. BMI factor. So they'll just go to the chart and say, okay, oh, well, you're overweight or whatever. When you're trying to get insurance, that may factor in, or even, in some cases, life insurance or whatnot. They always try to use, these factors to kind of categorize you. And it's always to try to get you in a lower setting to where it is. They don't look at like your overall fitness. In fact, even when you go to a doctor now, very rarely do I see where they actually give you a fit test when you go for an annual physical. Like, in other words, you go in there and they're going to take your, their scans. They're going to do their, what's those things that they put on you where they get the resonance readings and whatnot. But they never give you, I've only been, I think, one time to a doctor where they actually had, okay, get on the treadmill. And we want to monitor your heart while you're either walking or running, or sometimes they got the one where you're going upstairs. Yeah, like for like 30 minutes or whatever. We just want to monitor your heart rate and everything. Everything there. It's like you're going in fasted, and they don't necessarily, care about your level of strength. They don't measure your level of endurance, cardiovascular health, but they do have that one EKG that they set up, and I guess that's like the only marker. But they don't they don't measure fitness very well. So it's definitely makes it harder when what the criteria they use might be outdated.
Keep going. My mom is calling me. I need to take care of one thing really fast. I'm sorry, guys.
Sure, Jay. No problem. So again, those are things. Now, again, BME was saying, sometimes they pay for BBLs, some insurance companies. So again, that's another thing, with what the way insurance is measured in the United States, because it is private. Again, depending on where you go, who you get your coverage through, a lot of times some cover more than others. And some things that you would think would be basic things are not covered by insurance, by private insurance. And again, if you're living in the U.S., most of your insurance is going to be by private insurance companies. We don't have any kind of universal care. I know you have Medicare, certainly for folks over 65, but we know that only covers a certain amount, especially when it comes to prescriptions. So, if you get your standard Medicare, then you get your Medicare Part D, that covers some things, but it doesn't cover everything. If you are poor enough, you may, depending on your state, you might be able to apply for a Medicaid program, but you got to be like pretty much near a poverty level to qualify for those additional benefits. So you really have to, be in particular situations to get any kind of state or governmental support when it comes to healthcare. And, certainly just my recent travel, just going into the South, I did a little research on it, because the one thing I noticed in the South, at least where I was, is that, the lifestyle of the people down there is not necessarily the most health conscious. The food that they typically tend to eat, the diet, sometimes the lack of exercise, the lack of physical activity is certainly something that you don't see a lot of people really like here in the Northeast Jersey, New York area, whatnot. You see a lot of people who seem to take their fitness a lot more seriously. In the South, just based on the lifestyle, it seems to be a lot less than what you would have here. And it's interesting also because a lot of those states don't even participate in a lot of the governmental programs, like the Medicare programs, or, subsidies that may come from federal government grants for healthcare. A lot of these southern states don't necessarily participate in, but a lot of them have, certainly poor outcomes when it comes to healthcare overall. So again, there's so many factors involved in terms of the quality of care that you get from state to state, from country to country, and also factoring in, again, people's individual lifestyles and some of the lifestyle choices that you make, makes it very complicated a lot of times. Again, indeed, a gray area where people are trying to decide, trying to figure out, what's the best way forward, who offers the best care, what's the best sort of healthcare mix that I can get, and so again, when you're shopping for it, even though you have a sort of a governmental plan, they used to call it Obamacare. I don't know what they call it. I don't know what they call it now, but that marketplace where you're supposed to buy health care, a lot of it's going to depend again on your existing conditions, whether or not you have a family or not. So many factors involved, and certainly healthcare can become a major part of one's income, percentage of your income, especially for older citizens. And so you definitely have to factor all of that in when trying to figure out what's the best route to go. But I think I will always certainly side on the idea of just you want to stay out of the healthcare system as much as you can, and that's going to be based on some of your efforts, your lifestyle, diet, exercise, keeping your stress levels down, etc. That's going to make a difference there. But Pete, certainly your thoughts on just the healthcare overall. And again, I don't know with Pennsylvania, so that's kind of where you're at compared to I think Jersey. We've been blessed to be able to have decent health care, certainly cover my kids off. Some of my kids are still on my plan up to age 26. So we've had pretty decent coverage over the years. But what's it like in PA? Because I know you worked you work for universities and whatnot. So what's it like for you when it comes to
so I
coverage?
actually worked for healthcare companies and not work with it. So let's tackle when I did not work for healthcare, just regular insurance for a couple companies. Before Obamacare, it was decent overall, to be honest with you. It wasn't crazy. After Obamacare, it was pretty good, actually. I'm not going to deny. I had pretty good insurance through a company called Cuppins Group. That's an Airmark. I couldn't complain. Anything I needed to take care of, it was pretty good. Now, when I worked for the healthcare companies, that was a blessing in disguise. Even Mariana has worked for one of my old companies, Lehigh Healthcare. One of the major hospitals. I think they're starting to be towards Jersey too. I'm not mistaken, but closer to me, not towards you. But great insurance. I mean, I was paying $35 an hour. $35 a month. No, per paycheck. My apologies. And they covered like 99.9% of everything.
That's pretty good.
Yeah. I'll put it this way: when I got my kidney stone done, my bill was only $200. With doctor's visits, the surgery, anesthesia, testing, you name it, everything. Didn't have any issue worry about it bills. Now, I know other people who use the healthcare insurance to the healthcare barely have a bill. The bill was so small, it's not even funny. A lot of people work for hospitals because of how good the benefits are, if that makes sense.
Exactly. Yeah. And some people even working for companies, like I remember when Starbucks became a thing back like in the 90s. You had a lot of people who were taking part-time jobs at Starbucks because they didn't pay you a lot in terms of salary, but the benefits are really good. So let's say you can have like a full-time job and working like part-time at Starbucks or whatnot. And, with the coverage that you would get, it would still be, it'd be worth it, to a lot of people. So definitely, again, what you have access to, the company that you work for, certainly if you work for the state. I know my wife works for the state, so certainly they've have a pretty good health care where I've seldom, since we've been married, I've seldom had to get my own insurance. With the exception of some eye care and plans. We always rate shop because in fact we're coming up on I think starting in October they usually open up, like they have like the annual enrollment. So you pick, they give you options and whatnot. You pick the options that you want. So a lot of times I may take care of some of the dental and vision stuff or whatever, but the primary health care, again, that's taken care of through my wife. And like I said, the state employees, they get pretty good. They get pretty good coverage here. So, it's compared to what, the place I work for now, certainly is, we get a savings, and there's familiarity because we've been using these guys. We've been using these guys for so long. So I want to go back and highlight something that Braxton said, and I think it's a good point to raise when talking about health and fitness. So again, still someone can eat as healthy as they can, be physically fit, doing yoga, etc., and still have 4 or 5 different health problems. Yeah, none of this stuff is a guarantee. Your health is not a guarantee. And I think we have to understand. I mean, we've all seen very healthy individuals who live in a healthy lifestyle, do everything that they're supposed to do, and they still get sick. They still get cancer. I mean, that's the reality. So I mean, all we can really talk about is how can you, as best as you can, what you can control is to mitigate symptoms and to mitigate risks for disease. Even most people, like if you smoke, for example, most smokers will not get cancer from smoking, but a lot of them will. You know what I'm saying? It's like the number is up there, but again, your risk for cancer grows up, especially lung cancer grows up dramatically when you do smoke. But as far as the people, if 90% of smokers got cancer, I don't think there'd be a lot of smokers. So obviously, there's a high probability, you increase your possibility of it, but your probability is still going to be relatively low. So, but all you can do is like I said, mitigate that against current things. And then also there's a difference between being fit and healthy. So again, being fit, I described on, we did a show on Sparta's channel talking about this, and fitness is basically your ability to do things, your ability to do tasks. So again, whether you be an athlete or just being able to do just daily tasks or whatnot, your ability to do that is a measure of your fitness. Health, though, is really the absence of things. So again, health is the absence of injuries, the absence of sickness or disease. So you can be perfectly healthy, but have no fitness whatsoever. I knew a guy like that. I mean, there was nothing wrong with him, but again, the guy was so weak he could barely lift 20 pounds. But then you have athletes, again, if you're playing football, most football players I know, you're going to be playing with some sort of injury of some kind. Most football players, especially at the pro level, they're playing at like 75, 80% capacity because they're dealing with something. But because of their fitness for the task of playing football, such a physical and violent game, certainly they're still better than most people who are healthy, in that. So we need to certainly make that distinction certainly between the two. But you're always going to be, nothing in this life is going to be guaranteed. But again, what could you do to improve your chances so that you mitigate the risks of these things? That's really what we're talking about tonight. Mariana talked about the cost of healthcare in the system here, and then Brax had another one. As soon as someone who's on Medicare starts making more money, getting themselves in a better position, they'll be cut off and have to pay out of pocket if they don't get insurance. Yeah, I mean, certainly there's another thing that you have to. Yeah,
I know people who got surgeries or anything, they get charged less when they don't have insurance out of pocket when they get billed by the insurance company.
Mm-hmm.
I think it's kind of hilarious in a way because they charge the insurance companies an arm and legs. But when you get out, it's cheaper. It makes no fucking sense.
Well, again, it's the profit motive. I mean, we also got to look at the cost of things. Like you go to a hospital and because my mom, she was last time she was, I would look at some, what they charge for like ibuprofen. It's like $10 a tablet where I can go down to the local, my CVS and get like 100 tablets for $6-7. So again, so the system, because there's profit in healthcare, certainly tends to dictate again these healthcare costs, what gets passed down, and then what ultimately you're paying. So again, it's definitely it's a big racket, and whether the government's involved or not, I mean, no one is going in and saying, it's like, wait a minute, is there any sort of market corrections for the cost that the average person has to pay for healthcare? But if you're in a system or whatever where they can charge you as much as they want for for drugs, for prescription drugs. And again, that's a for-profit business. And again, as much as we want to talk about capitalism in this country, again, capitalism has limits because again, there are groups that try to control in terms of, anytime there's been any kind of intervention to control costs, there's lobbies that try to drive the discussion to say why things are justified. I remember when my daughters, they've had allergies, so they've had to have these EpiPens, these sort of allergy pens. If you eat like some nuts or something like that, they give you a pen.
Yeah, like the bee shots and stuff like that.
Yeah, yeah. I mean, they got to a point where, for some reason, one of the leading manufacturers of the EpiPen, they blew up the price. It was like an EpiPen was like $800, and it just went crazy. But again, it was it's a for-profit product. And so because of that, certainly that certainly dictates a lot of the cost. So that's why you get this pushback a lot of times when people talk about, oh, well, we need like a universal healthcare system, or we need to get profitability out of healthcare. You always hear those arguments back and forth when you hear these stories about people having to pay so much for healthcare.
Two comments on this. Number one, so with margin of profit, like with diabetes, for example, they have proven overseas, they have found a vaccination to diabetes.
Mm-hmm.
Take one shot, boom, done. Same thing with cancer. But the problem with that is they makes way too much money for getting the insulin, the needles, the strips. Or now they have the meters. Now you can scan yourself instead, and that's cheaper versus than getting the freaking that's more money for them than just getting one shot, one kill, one shot kind of thing.
Yeah,
and that's kind of bullshit too. And like you have my mom, who she pokes herself every day, twice a day to get herself insulin.
Right,
and that's not cool.
Yeah, Well, again, most of the healthcare in this country is about treating sickness. And that's where the profitability is. I mean, in healthcare, they make their money based on you being sick. And it's just interesting how it kind of cycles in and of itself because, again, it plays off of, again, a lot of these lifestyle measures that we talked about, right? And we were talking about, again, your diet. Again, most people are not type 1 diabetics. Most people are type 2 diabetics, and type 2 diabetes is oftentimes tied to your lifestyle and your eating habits and whatnot. So if you smoke, if you eat a lot of sweets and carbohydrates, or processed foods and whatnot, that sort of feeds the diabetes, and then you need to take the medication to kind of offset that. Whereas again, if you made changes in your lifestyle, you could certainly help to offset some of those risk factors that lead to those sort of things. But so again, there's always going to be more money in the treatment of sickness rather than promoting things that make people healthier. Always.
That's what I think is funny. I just read an article. I got an email on Thursday or Friday. I can't remember to work because I get all this email still from. It doesn't matter if it's part of my department or not. I still get the emails through me. So they literally just released a new study about testosterone. Men who smoke have higher testosterone than men who don't smoke.
Testosterone, yeah.
I was like, and in the bottom of the article, it was a correction because years and years that it was the other way around. If you smoked, you had lower T, and versus if you're men who don't smoke are higher, is actually the opposite. They're saying now. I'm like, get the fuck out of here. I'm like,
well, keep in mind now, a lot of people do, studies have come out saying that men today generally have lower testosterone levels than men in process. But we all remember when we did the show on smoking, like in the 50s, in the 60s, the majority of Americans smoked. It was on TV, like you're watching a newscast. Walter Cronkite smoking a cigarette on the live on the television. Smoking was so popular. It wasn't until the 70s when the Surgeon General started coming out with warnings as far as smoking could be hazardous to your health, and that was even a big thing. Even with the smoking companies, they were trying to hide the truth of that. They knew that for years, and they tried to keep that. That fact covered up for many years. before that came out, before smoking may start to decline. So and again, we went through we went through the baby boom period and whatnot, and again, a lot of Americans were smoking. So it wouldn't surprise me that if the testosterone rates were high, I mean, it could be a factor. And I'm not advocating people go out and start smoking to increase your testosterone. I'm not
then you're
suggesting that at
turning
all.
at the same time. So that's the issue. Like, and I just literally watched an interview. Was it Friday night? Or it was Friday night. It was a lady. Was the oldest lady was 120 or something like that. She's the oldest person in the United States, and she's been smoking her whole life. She will not quit smoking. She enjoys smoking. She loves smoking. And she goes, I'm not going to quit smoking. I'm like, I live this long with smoking. And like a lot of people are like, here's another factor. A lot of cigar smokers. Yes, cigar smoker is a little different than cigarette smoker. It's more natural smoke. I'll give you that. And you're not supposed to inhale it. It's more for relaxation than the addiction.
Mm. But
people who are cigar smokers are live longer and they're more relaxed and chill. Like, whatever, dude. Like, I don't pay the bill. I'll pay it tomorrow. What's the worst case scenario?
Yeah.
Like,
well, again, managing stress is also a part of it. Now, again, Braxton made this comment earlier. It's like, you can do, we all can probably point to someone who drinks and smokes and do everything, eat steaks or whatever, back and forth. I still eat steak, but I'm just saying, but live basically an unhealthy lifestyle, and they live to be 106. Actually, have what Jack LaLanne. I don't know if you guys are too young to remember Jack LaLanne, right? Jack LaLanne, I think he lived to be 95 years old, but this guy was like in the 50s or whatnot. This guy was like the epitome of health and fitness. He had a daily TV show that was on. This is a guy who swam across channels and did all kinds of strength feats and everything. He died at 95. He had a brother who didn't do any of those things at all, and he lived to be 97. So there's something to be said for genetics. There's all kind of factors. Again, nothing that you may do is going to have a perfect outcome. You can certainly look at data and statistics, but there will always be outliers when it comes to people's health. And we can always point to someone. Oh yeah, I know someone who did all the healthy stuff and then died at 50 or whatever. I mean, that's always going to be there. But again, it's about looking, again, across the board, what is generally considered healthy habits that have measurable statistical data to back it up.
I'll give you another factor right now. My instructor who told me my shorts, Master Ray, he was always working out. He loved working out. He loved training. He loved, eating good food. And he was ripped at 75 years old. That's the first time I saw an old man have a six-pack. To be honest with you. And the only bad habit he had, he allowed habit to occasionally drink once in a while, like after a Friday night with a dinner, have a cocktail, and occasionally he would have a cigar too.
Right.
And if he didn't get hit by that drunk driver, he might still be with us today. And he wasn't died for a natural cause. He got hit by a drunk driver.
Yeah.
So here's the other factor I want to use now. All right, I was going to say before was I'm going to use Greece as a factor. Greece has a universal health system in a way.
Mm-hmm.
Little different when you think when I'm saying universal. So what they do is they pay taxes like we do.
Right.
The taxes are a little higher than us because they take it out of their taxes.
Yeah.
Right. So then you just, when you're up to age, you get insurance, you pick option A, B, or C, which insurance company you want to go, and you have option A, B, or C, like here. So you still have the option to pick what company you want to use.
Mm-hmm.
But it comes out of your taxes automatically. So everybody has health insurance.
Mm-hmm.
Excuse me. So you don't get this big ass fucking bill like you always think.
Right. But you're paying more taxes though. So
yeah. really better?
I don't know, because again, for a lot of the people, it depends. If you are a universal healthcare advocate, you're going to put a certain level of statistics out there and measures as far as, universal healthcare is going to be better. And then again, if you're into the private, like here in the U.S., then you're going to advocate for private, or you'll make the argument, well, why do people from all over the world come to the United States to get surgeries and whatnot because we have the best healthcare system. So again, it's like people take this from different angles and perspectives, but I guess I'm more focused on, okay, what is best, I guess, for the average person, for the common person. Does a universal healthcare plan, is that a better alternative to what we're doing now with the private insurance and whatnot? You have a lot of Americans who are not under coverage, currently right now, and are there alternatives for those who can't get coverage for whatever reason? Are there alternatives, or should we look at that? But it's hard to do that to me to have a fair discussion about that, especially in this country, because again of the profit margins in healthcare. And again, the fact that even when you're going through Medicare, Medicaid, or any kind of governmental subsidies and whatnot, what they're charging for these procedures, what they're charging for these medications and whatnot, that has no connection whatsoever with the market. Like I said, the fact that you pay $10 a pill for a Tylenol versus spending $10 at your local CVS for 100 tablets, there's something wrong with that, but that's what everything governmental. I mean, even in the defense contract industry, it's the same thing.
Like you guys know my mom has stage 3 colon cancer. So when the colon gets cut down, she gets what's called a chronic diarrhea. Pretty much what the name is, it is. She goes between 12, 15, even 20 times to the bathroom for diarrhea. Mm-hmm. So she needs to get on a very high dose of anti-diarrhea medication.
Mm-hmm.
You can get Imodium off the counter for like $20
mm-hmm.
Because this is a high dose. The pills are goddamn expensive out of pocket.
Mm-hmm.
Like they're like come out to like $50 a pop.
Yeah, but even when you say high dose, I mean, couldn't you just take more Imodium then?
That's exactly where I was going to. Like, even a doctor said to me, I was out medication once, and because with the insurance wasn't going to cover it for some weird reason.
Mm-hmm.
He goes to me, listen, I'm not supposed to tell you this, but just go to the store, buy 2 boxes, and except giving her 2, give her 4 or 6.
Yeah,
and I would do the exact same fucking thing.
Yeah, I actually went to a dentist one time. I had something going on with my gums, like an infection in my gums, and my dentist, she wanted me to take this solution that was sold in the at the drugstore or whatnot. You needed a prescription for it, and so I go to the drugstore, and this is also something. There's a difference also between like the chain drugstores and your local pharmacy, and that experience made me a big believer in local pharmacies, because again, when you go to the chains, they have a scale, they have a thing. So again, they wanted to charge me $50 for a bottle of this solution. I go down to my local pharmacist and tell him what I need. And he literally walks out from the counter, goes into the aisle. He gets some common everyday stuff off the shelf, takes it back into his area, mixes and shakes it together, puts 2 bottles on the counter. That'll be $7. For the same thing, because again, the local pharmacist is like, I mean, true pharmacists are like, you're like the alchemist, right? I mean, the alchemist from back in the day, you would take concoctions and mix things together, because he understands what this, how things are made. He was able to fashion something for me where if it's like a consumer brand of something that is has a brand name on it, you're really playing for the brand name of the item. You're not playing for the product. But again, if you know chemistry, right, then it's simply about getting the ingredients. Sometimes the cost of the ingredients is a lot cheaper than getting the brand. But that's all you're paying for. It's the same thing with anything. I mean, even clothing, right? Yeah, I mean, you buy Nike sneakers for $200, but they're making them for like $15 in China. It's to me, it's the same thing. I mean, in America, everything is about brands here.
Yeah, I how I feel about buying sneakers for $200-$300. I think it's retarded, to be honest with you. But again, there's sneakerheads who love that stuff. But sometimes buying the genetic medication is as good, is as better sometimes than buying the name brand stuff.
Oh, for sure. Because again, it's about the chemistry. But that's with anything. Like when I was building my gym, right? I wanted to get some of those, those gym mats, those really that hard rubber flooring.
Yeah.
If you buy the stuff from Fitness Center, they want $85, $90, $100 for a 4x6 mat. I go to Agway, which is essentially like a farming or like tractor what's that TS tractor company the tractor company, something like that. You get horse stall mats. It's the same material, but because it's for an agricultural purpose versus a gym, when you get those for $35.
Here's a great example. When they were measuring my mom's leg for a procedure she was doing, they put a plastic bag around her, a plain garbage bag.
Mm-hmm.
And I looked at the guy like, what's the difference about that garbage bag and that one I use at home?
Nothing.
It has healthcare grade on it. We mean, so you're saying to me right now, dude, I can take the same bag I have at home, bring it here, measure my legs, and do the exact same thing. Yep. I go, and the only difference is one has healthcare and one doesn't. Yep. And I'm paying what, probably $1.50 a bag, like close to $500 a bag. I'm like, you can kiss my hairy Greek ass. I went home. And it's a bag. Nothing.
Like I said, it's a racket. But you see this across the board. You see this with, as I was saying earlier, you see this with military spending. And again, there have been times in history. I know Harry Truman, I think he made his reputation in Congress as a senator because he went through and he was going through seeing how much does a ribbit cost? How much does this piece cost and that? And again, these companies were charging exorbitant amounts of money for things that cost a fraction of the cost if it was priced out in a marketplace. Mm-hmm. So anytime you want, for those who are for a public option or a getting profit out of healthcare, there's plenty of cases, both anecdotally and even if you look at the statistics and just look at the medical bills that people are paying and what they're charging for, for tests and how many tests that you have to go for and all of these different types of things, you can certainly make a case that something needs to change when it comes to the healthcare system. And it's all about a lot of people making money at the expense of unhealthy people. And that's why even more so why I'm encouraging people to start to take things, matters into your own hands in terms of your personal lifestyle. Because again, you might be one of those people who can smoke and live until 105. Is it likely based on the data? Not necessarily. So I would always encourage people to do better in that regard. But go ahead.
Look at my mother. She's been smoking for her life and she's still kicking. And yeah, she has other health issues. And it's not most of her health issues are not smoke related, believe it or not. And most of her health issues are overweight related. Mm-hmm. If she took care of herself, she probably could smoke as much as she wants.
Does smoking make you eat more? I know they talk about if you smoke weed, that gives you the munchies and whatnot. Does smoking make you eat more than...
The opposite, actually. It decreases your appetite.
It decreases your appetite.
Yeah, so you don't really eat as much. Now, when I quit a couple of times, I just wanted to eat all the time. I'm like so you know what? A part of it is because you're always doing something with your hands. You're always keeping your hands busy.
Well, there's also a dopamine response, right? I mean, when you're smoking, you're getting that dopamine release.
Correct.
And same thing when you're eating also. So it's almost like you're looking for that fix. So if you don't get it from the cigarette, you get it from food or some other source or something like that. But there's definitely it seems like there's definitely a connection between, what you, again, giving up something, but what are you going to replace it with?
Yeah. So as we were talking, I also looked up the DEXA scan, if insurance will cover that. It says here, if insurance will cover it, if a medical provider thinks you need to get it done. Mm-hmm. So it has to be a reason behind it. Like if you ask them, listen, like you see your primary, I want to get it done, see what my BMI, but whatever the case is, most likely he will get it done. And the copay usually is between $50 this thing, give or take.
Mm-hmm. Yeah. Yeah, but yeah, like I said, it's your doctor has to prescribe it. But if you just want to take matters into your own hands and say, look, I want to do this, I don't know how much it costs out of pocket just to get it without insurance.
50.
If 50, $50 out of pocket,
No, 250.
250 with no insurance, 50 with it.
Yeah.
Yeah, I mean,
So most doctors, if you explain to them why you want to get it done, from my experience working in the healthcare, it's just listen, I want to get done because I'm trying to get my health a little better. I just want to see where my fat is and all this stuff. And he goes, most likely they will cover it. They will write the script
yeah.
for it.
Well, only well, I think only. I mean, if there is like an overweight issue, like if your doctor's looking at you and said, yeah, you need to lose some weight or whatever. If it gets to a point where your weight becomes a health risk, then I can see a lot of doctors signing off on it. But if you're going in like 12% body fat and you're like, yeah, I want to get one of those health screenings done. I don't know, if they'd all sign off on it or not. But again, that's a doctor's decision.
Yeah, it
What's
depends on
that?
the doctor. Like some doctors will sign off on it. They don't have an issue.
Yeah,
Yeah. It's just a scan. It's not going to do any damage. You know what I'm saying?
yeah, for sure, for sure. But I want to kind of share some of this. I'm always looking for like global perspectives when it comes to healthcare. So I've gotten some slides that I gotten from again Statista is a site that I use just to kind of get global perspective on things. So again, we talk about the cost of healthcare, and clearly here in the United States, it's the most expensive in the world. $12,000 per capita in the country, whereas Canada is a lot less. Now, again, part of that could be mitigated. Now, Canada, again, has generally a universal healthcare system. In fact, most of the countries that you're seeing here, they had a universal healthcare system of some measure. Shout out to Craig Lucas, who's in the house tonight as well. Question, Craig, does UK, do they have basically a universal healthcare system in UK? Is there a lot of out of pocket expenses, or if there isn't, then generally are your taxes higher because of that? If you could share that in the chat, certainly we'd appreciate it just to give some personal perspective on this. But we do see here that certainly Canada and UK have half the healthcare cost per capita than in the United States. And then again, countries that worry most about healthcare. So again, where it's not necessarily as good, again, Hungary, Poland, Brazil, again, United Kingdom, China, again, United States, even though it's the most expensive in the world, there's still a high percentage of people that basically say that, that are still worried about, again, one, to be able to get coverage, to see, second, is there coverage enough? You may be getting some coverage, but again, when you have a lot of the co-pays or the out-of-pocket expenses, there's still concerns about that. But again, countries where, again, there's generally universal coverage, Japan, Peru, France, India, Germany, South Korea, and Turkey, there's not a lot of, concerns because they generally have some kind of, some kind of universal system. So Craig is saying that there's some so there is some private in UK that you do have to pay for, but at the same time he's saying it's sort of free. So it may be a mixed in. Some of it's free, but then there's certain things that you have to.
DR system, like a DR, for example. If you go to a how she said it to me. If you go to like a hospital, it's free. You don't have to pay for it. But if you go to a clinic, that's what they call the private practice. Yes, that's when you have to pay for it. So it really depends on how you want to break that down also. So every country does a little different. So yeah. Take it when I saw it, I guess.
Gotcha. Got some information here. So again, which countries have universal health care coverage? So, the United States is the only developed country that does not have a universal health care coverage. So we saw a couple slides ago, United States has the highest cost per capita insurance in the world, but they're also the only developed nation that does not have a universal system, where it contrasts to Germany. Germany was first on the list to establish a social health care insurance system back in 1883. So again, a big difference between countries and whatnot, and health outcomes. when it comes, certainly in those countries. Here we're talking about, again, as far as GDP, when it comes to healthcare coverage, how much that you're really spending on. Again, United States, it's basically it's not even 1% of our GDP that we're spending on healthcare. Given our population and whatnot, it's less than less than 1% that we spend. So when people talk about healthcare costs depending on GDP, it's definitely a lot less. Contrasting least affordable healthcare countries for healthcare. So Greece, with certainly a much smaller population, they say 9.37% of their costs go towards healthcare. So there's certainly a much higher premium that people pay in Greece for healthcare, contrasting that to the United States. But again, even though it's a small fraction of our overall GDP, it's still a very high cost overall. So these are things that certainly I picked up. Here's another one here, rankings. Okay, so this is from International Citizens Insurance, overall rankings on healthcare systems. So again, for what we're getting, right, the most expensive in the world, but we ranking according here, as far as overall rating, we rank 10th in the world compared to other developed nations like Australia, Netherlands, again, Canada. It seems like we're not getting a lot of bang for the buck when it comes for insurance. But one thing that does seem to measure in our favor is, again, the care process. Like I said, I've heard stories about folks in Canada, the waiting list sometimes to get access to healthcare can certainly take a while compared to the United States. But again, they still rank 4, overall. Sweden has a much higher.
These numbers are showing. It seems like we're doing something wrong here.
Yeah, well, again, I think, again, you'll have people debate. I think the fact that, again, the profitability in insurance, that we're paying so much for it, but we're not getting our money's worth. And as a nation, we're not even paying a whole lot. We're paying less than 1% of our GDP on healthcare. Whereas compared to that, what we're paying for military spending or some other, and again, this gets into a political conversation as far as what the country wants to prioritize. But again, when you're talking about, at the end of the day, kitchen table issues about what people are paying for and what are they getting for their for their money, Craig is basically saying, yeah, we may be getting screwed in the U.S. For the amount of health care that people out of pocket on average have to pay, whether it be taken from your paychecks every week. Even if you have a company.
He's right. Plan. I tell you why. I work for companies, and I didn't last long because I couldn't afford an insurance. Like the insurance of one company I work for, $120 a paycheck. Mm-hmm. That's a good percent of your paycheck. $120
it is
for the lowest plan.
Right, and depending on whether or not, again, is this a single person? Is it a married person, or do you have kids? Because then it goes up. I mean, when you got kids, that's when you're going to spend the most for healthcare. Is when you're married with children. But you're single, you shouldn't see that much. But again, for us, and as we told our kids, it's like, look, you guys stay with us until you're 26 or whatever. So, but it's interesting. My daughter, she actually had to get, for medical school, they make you buy insurance. So she has an insurance plan, especially when she's out of the country. So she's technically, when she's away, she's on their plan. When she comes home, she's covered by us, but she's only got like another year or so of that left. But the other two, we're like, there's no need to sign up for insurance at this point. My youngest, she's 22. So, I mean, she's going to be, so she can, certainly, save some of that money that she would have been spending if she sticks with us, for the time being. And she still lives here. Now, if they decide to move out, then they would have to do it because they're no longer dependents. They're not living with us. So, so certainly they would more likely in that situation, they'd have to, they would have to get their own.
At least you're doing it the right way, because I know a lot of people who their kids don't live with them, but they say they keep the same address just for insurance reasons, and that's
yeah. Yeah, I mean, it's people try to, like anything else, they try to get the most out of it. Healthcare in Greece. So again, you were talking about that earlier. I just want to get this little blob in. So again, Greece, as you said earlier, it does have a universal a healthcare system provided through a national health insurance, just like Craig was saying earlier. They also have an NHS program. Says here, according to 2011 budget, Greek healthcare system was allocated at 6.1 billion euros, or 2.8% of GDP. So again, Greece pays almost 3 times as much in their GDP for health insurance than it does the United States. The Greek healthcare system is ranked 14th worldwide in overall assessment, above other countries such as Germany and the United Kingdom, while ranking 11th in service. Healthcare in Greece is provided by the National Healthcare Service, or ESY, provided, in Greece. So, so just to kind of contrast it. So, yeah, so America, we're the only ones who really don't have a national system like that. And I remember when, you had, the Obamacare came out and what political fight that was, and people, there were scare taxes all the way around, or, they'd have death lists and all things that kind of spooked them. Yeah.
I'll be honest with you. I prefer paying a little extra taxes, so I don't have to worry about is an insurance thing every time I change a job, or my company changes, insurance coverage, or whatever the case is. I pay a little extra taxes, I'm good with that. It's one thing that you have.
But you just mentioned something, because I don't know. I'm sure it's in PA also, but you talk about insurance between jobs. So I know in New Jersey they have this what they call a COBRA program. I don't know if that's nationwide or not. COBRA. So again, what you pay for COBRA
is ridiculous.
Is outrageous.
I absolutely. So we all get fired from jobs. We all quit from jobs. I always get them in the mail after my insurance lapses through one job into the next job. And it's usually like a small period of time. Mm-hmm. And I looked at them like, yeah, you're on crack. I'm going to pay for this shit. And like, even the insurance, the government, they have a thing called Penny now, the insurance thing. It's supposed to be cheap insurance. Bullshit. That's just expensive still.
Yeah.
Like when I saw that one job I had, it was $120. I was like, I can't fucking afford that. I'm so used to paying between $35 to $50. $55 the most I ever pay for a single plan, the middle tier with dental and eye.
Right.
Anything over that is way too expensive, I think.
Yeah. 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 It's and again, it punishes again if you're healthy. That's when, again, you're going to pay the least for it. But again, if you have, now they say technically they're not supposed to factor in some of these cases pre-existing conditions or whatnot, but in a lot of ways they still do. And so again, you trying to you trying to shop independently for it and whatnot. It's going to be it's definitely going to be a struggle. But generally in your now didn't you work for a hospital at one point?
Yes, I twice actually. I worked for Lehigh Valley University, Lehigh LVHN, Lehigh Healthcare, and St. Luke's Healthcare. Even now, I still technically work for healthcare. It's a nursing home. So, but the big companies like Lehigh and St. Luke's are usually the ones that are the best insurance plans I had.
Yeah. Yeah. Now, let me ask you a question from the standpoint of dietary, because obviously you're a chef. And I've always, certainly, now I've spoken to, just people who, because we got a couple local hospitals here. And I've spoken to a lot of dietitians sort of off the record. And they'll say, you get your dietary degrees and whatnot, and they'll tell you, these things are good and these things are bad, or what a program is. How often did you interface with dietitians when it came to what you should and shouldn't be preparing for patients? And do you honestly believe that what you were actually preparing was in the best? Because everyone talks about how bad hospital food is. Not yours per se, but across the board, everyone talks about, it's like anything but hospital food.
Okay,
why is hospital food so bad? And generally, are you actually working with dietitians to give healthy but hopefully tastier choices to patients in the hospital?
I can't speak for everyone. I can speak for me. I always, even Mariana's in the chat, she can vouch for me too, because she also works for a hospital herself. Me personally, I was up their ass 24/7. I want to know every little detail in what we need to do.
Mhm.
Like, to the point like, Pete, what do you want this time? Like, that's how far up the ass I am, because I'm making sure. Rule number one in healthcare food is we do not use salt.
Mhm.
Because what does salt does, Paul, to your body?
Well, it definitely you certainly retain water, but having said that, it also it raises your blood pressure, I believe.
Yeah. So when you're preparing food, I don't know who's getting what at the time.
Mhm.
So I'm doing bulk stuff. Like I'm doing like
Mhm.
20 meatloafs at once. I'm doing like
Mhm.
150 chickens, or whatever the numbers are. It depends on the hospital. Like at Lehigh, I was doing 150. At St. Luke's, I was doing 500.
Mhm.
I don't know who's going to order one till that line starts. When those tickets starts popping up, or I get my tally, I got a
Mhm.
paper. All right. So some of that stuff is mumbo jumbo. I don't,
Mhm.
in short, there's a protein shake. I cross that off. I
Yeah.
cross what I don't need, and I just eat, and I get what I prepare my line the way I need to get set up for that.
Mhm.
So when those tickets come popping, I don't know who's getting what. I get that ticket and I put her up, and I see, okay, it's believe it or not, as a dietary chef or cook, you get more information than you fucking need for your job.
Mhm.
Like on their tickets, it will tell you their name, their last name, their social security, their birth, their diet, and why they're in there for. Like, I don't
Mhm.
even know that shit. I just need to freaking, what their food is and what room is going to it. That's all I care about. Now,
Right.
my bread aides, who delivers the food, they need to know all that stuff,
Mhm.
because they have to, like, say they come up with a tray, they ask you, what's your name? You say,
Mhm.
Bennett. What's your birthday? Blah blah blah, and they'll ask you some more questions to make sure you get the right tray. And how
Right.
many times I tell you that a wrong tray has gone to the person? I'm like, all right, I don't have hair right now, but if I had any, I'll be pulling it out.
Right.
I'm like,
But
so
is the base food that you're feeding people, is it good quality? Let's just start there.
believe it or
Is
not,
it?
is decent quality.
Mhm.
Because sometimes we get, sometimes when Cisco, that's what 99% of any restaurant, healthcare, or any food providers get their products through Cisco.
Cisco? Okay.
Cisco's the
All right.
company.
Okay.
You've probably seen the trucks around all over the place.
Mhm.
So sometimes you don't have a choice what they send you. They send you some, like, I have sometimes, chicken. I'm like, I have chicken with like feathers on it. I'm like, huh?
Yeah, yeah. Or the meatloaf is probably like everyone complains about the meatloaf they may get.
Okay, so
You know,
meatloaf. Here's the catch with meatloaf. We do not use ketchup in meatloaf. If I tell you what we put on, you're gonna scratch. You're gonna look at me like, what?
go
We use
ahead.
mustard. We use
Mustard instead of ketchup in a meatloaf.
exactly.
Hmm.
Yeah.
And why is that?
Because the sugar count is lower.
Okay. All right.
Diabetic again. Like,
So again, it's got to be low salt,
yeah.
low sugar. What else? Gluten. What about gluten? Is it gluten free?
So gluten, you're gonna see the ticket. He will say if the ticket comes up, it says, "Oh, gluten needs to be gluten free." He's not getting meatloaf. He's getting something else. He's gonna get like a burger on a gluten free bun, or a chicken breast, something else.
Mm-hmm.
Gravy should always be gluten free on the line.
Mm-hmm.
The go-to for dietary, you don't make your own. I'm the only one who's allowed to make it in house,
Mm-hmm.
because I can make it gluten free and gluten.
Right.
So the difference is use a roux is flour and oil, or flour and butter. I use oil better. It's just better texture for the food.
Mm-hmm. Right.
Gluten free is just cornstarch, pretty
Right.
much.
And
So
then why the vegetables are overcooked? I've never been to I've never been to a hospital where the vegetables are always mushy.
yeah, I can tell you
Never
why.
el dente. Never. I mean, just
I lose my goddamn shit when they serve me overcooked line. Like, I'm sitting there, my arms are crossed. I'm watching. I'm like, you're not fucking serving that. He goes, oh, nothing wrong, chef. I go, if I bite that and it's mushy, you're gonna be wearing that. He goes,
I mean, you cook the vitamins. I mean, the color, the phytonutrients in the veggies is cooked out of the by the time they're served. I never got that.
It depends on the staff. I had two different kind of staffs. One staff of mine we used to get all fresh at the time. All right.
Mm-hmm.
I was so excited about that. But the problem was these guys are not going to be able to keep up on the line, because it takes a little longer to cook it up, because you're on a time layer there. You have to get that food out at a certain time. You have a small window, 5 to 10 minutes per floor. The floor could be 10 people or even 50 people. You got to pop that food out fast as possible. And those traders better get that fucking food out of my window as fast as possible because healthcare got rid of the heat lamps completely because it dries the food up. And I'm with it and against it at the same time. I'm with it because, yeah, you shouldn't be sitting there more than 30 seconds in the window. I'm against it because if they're slow on their side, that means my food is going up the cold because once it leaves my kitchen, I lose between 20 to 50% heat off that food by the time it gets to the floor.
Right. But yeah,
so
exactly.
The veggies, what happens is two things. Okay. So let's say you use fresh veggies. All right. You have to blanch them ahead of time. So you put them in a big kettle, hot water, whatever. You blanch them, take them out, ice bath them. Boom. No problem. Now when you reheat them, you only have 2 to 3 minutes in order. That's it. Now that heat well produces heat all the time. Now they're sitting there the whole time.
And they get mushy.
If you're on let's say, okay, the first floor you get served, let's say back at Lehigh was 6B. I called it Arkham Asylum. There were the Looney Tunes there. All right. They get served first always. The second floor, to say, I believe it was CB Tele, if I'm not mistaken. So that's the second floor. They're good so far. Now, once you get into second floor, 2B, 3B, 4B, 5B, once you get a higher tier, now there's your problem. That's why I made this guy batch cook.
Right.
The food of the hospital has gotten so much better over the years. The quality, this was hospital food, this was restaurant food. Now they want to be better than hospital. The quality is supposed to be more what's called bedside food. Bedside is more restaurant style. That's why the menus are set now.
But you still avoid the salt and the sugar.
Some things you have to avoid. You can't, do it correctly. And the salt is mostly, people think salt is more for flavor. That is actually wrong. It's a flavor multiplier, believe it or not.
Okay. So
let's say if you're having steak and you add salt and multiplies the flavor times 2 or 3. Mustard is a cool factor. And you're going to like that. Anytime you add mustard to the food, I always add mustard to all my chickens. It doubles the protein in it.
Okay.
People don't usually know that. And that's where the macros comes, like, you were talking about the other night about macros again. And that's a hard time trying to figure out what kind of macros you have. Because if you know the tricks like I do, you need to add a little mustard. It says only 30 grams of protein. I'll have 60 grams of protein. But the apps are not calculating that.
Right. But have you ever gotten into arguments or disputes with the dietitian on the floor in terms of what they're recommending you need to be serving and versus what's based on what your experience to serve on? Because again, I've talked to a few of them and they were like, again, the recommendations what we have for people. If I was to speak off the record, they shouldn't be eating this stuff. I mean, so it's
yes and no to that question. No, I did not have to get an argument in the hospital because we were on the same page always. Gotcha. Now in the nursing homes, I have gotten head to head with them. Like for example, grounds. Why is grounds getting regular veggies? Oh, that's how we do it here. But they're grounds.
What do you mean by grounds? What is that?
Grounds on mechanical means you put it through a processor and you grind them down.
Okay, got it.
And swallow usually. This is what we call a choke hazard. So when it comes out, and some of them say, you can our grounds can have regular veggies. Like, no, they're not. But yeah, they can't. No, they're not. They can't have that. And I literally break it down for them, like, and they look like they're stupid. Like, how long you been doing this job? I went to him. He goes, like, a few weeks. That's your problem. Pick my brain. I'm gonna help you. You're not helping me. Like corn, you cannot serve corn to purees because nursing homes make puree from scratch. And this is where I can't stress this enough. Test your purees. I always tell my guys, the hospitals will call what we call hockey pucks. They come in little packages. You put a steamer for 30 minutes and you just pop them out and call it a day. It's an insurance thing. They cannot take that risk. Now with the nursing homes, because the budget's not that high, they have to make everything from scratch. Now, there's a couple problems here. One, I don't have enough product to usually do that. Not because I'm not ordering enough, or my person who orders my stuff usually doesn't, my ordering manager doesn't order me enough, and I'm usually getting a screaming match with them. Yeah. Or B is we don't have the budget, so I have to scramble solutions like meatloaf. I got extra. I used to save my burgers for a couple of days, and I pile them up, and I use those as purees.
Okay.
So I tell everybody, puree, I don't use water in my puree. I tell everybody, if I use puree, you're going to be wearing the water. End of story. And you're going to eat the whole puree at your punishment because I'm not going to write you up. I'm going to make you eat it. Very simple. and people don't want to eat purees. Would you like to eat puree, Paul?
Not necessarily. Shout out to Lady Navoa. Haven't seen you for a while. Hope everything is well with you. Good to see you in the building tonight. Welcome back. Always a pleasure hearing from you. Appreciate it.
So when it comes to purees, I'm going to show you guys a picture. Let me just find it really fast. I tell everybody to taste it because if there's even the slightest lump in it, you can kill somebody. That's how serious it is.
Mm-hmm.
There is no joke when it comes to purees. So I'm going to share my screen. This is a puree I'm going to show you. And this is I prefer this type of puree because this looks like more like food. Whenever you're ready, Paul.
Got it.
This is a breakfast puree. Does that look like a puree to you?
No. Looks almost like a dessert.
Yeah. So this is a breakfast puree. It is sausage, egg, and cheese. Okay, there's cheese is on top, obviously. Cheese is right here. I don't know if you guys see my mouse. The sausage is here, the egg, and the cheese sauce is just for moisture. You always want to put a little gravy on it. All purees, grounds, and minced and moist.
Mm-hmm.
Minced and moist are pretty much what it is. Minced food, very tiny with gravy.
Yeah.
Always want to put a little gravy. Again, it makes me swallow a little easier.
Mm-hmm.
So, this is the way we're supposed to go. But again, a lot of places don't want to do that because it's a lot more work. You know, a lot of places use what is called thickener.
Mm-hmm.
I hate using thickener because thickener takes away.
What is that, cornstarch usually?
No, thickener. It literally it comes in a big box. It looks like Coke. I mean, like blow. Literally looks like cocaine.
Right, but I'm saying, but a lot of those thickening agents is usually cornstarch.
This one does not have cornstarch actually.
Got it. Okay.
Don't remember the greens off my head right now, but the I like using what's called Zempogun. Zempogun is, you ready for this? Duck grease.
Oh wow!
Yeah, you seen the bottles of pre-workouts, right? You know how big they are.
Yeah.
That's how much they are. For 5 bottles, I'm paying about between 100 and 150 a case. I go through one little bottle for making about 20 purees. That's why nobody wants to do that because the margin and error is not there for the companies.
Mm-hmm.
So it goes back and forth with that. I can argue this like all day long to turn blue in the face. Like some foods you cannot puree. Some foods that people cannot have as special diets. Corn is an example because the skin of the corn they cannot swallow. I can sit there for hours try to break it down. It won't break down. Even
if you put put it into a Vitamix, it's still not breaking down.
I have what's called a Blixer.
Okay.
Some companies. A Blixer is like this fucking big. It's a what's the word I'm looking for? It's an oversized steroid food processor. It has literally 2 blades that turn around. You cannot turn this on for safety reasons because it locks in. And the safety, if it's not lined up correctly, it won't turn on. Right. This fucking thing will take your fucking hand right off. That's how it's 2 speeds. High, super high. Mm-hmm. When I put on super high, it sounds like a goddamn jet plane is going in my kitchen. Yeah. So that thing will break down most things. I can sit there and break it for hours and hours and hours. Corn is one of the things. Now, cream corn, now you're talking about something, is processed a different way and boil the living shit out of it. I could do that.
I can see there's no nutritional value in it. That's the thing. You know, when you have veggies that are overcooked, when you have the cream, I mean, a lot of those items, I guess it's just filler. But again, in terms of, is it nutritionally beneficial to the patient when they're eating it? That's always been my thing.
I was talking to my dietitian at St. Luke's, and we're going back and forth about the carrots. He goes, she looked at me, what's your opinion about carrots, Pete? I go, leave the skin on. I'm like, what? Leave the skin on. I'm like, that's what the vitamins are, all the nutrition. She goes, you're right. But can they choke on it? I'm like, I bet you $100 it won't. He goes, all right, let's try it. We did 4 sample plates, a regular diet, minced and moist diet, what was it? Soft bite diet and a puree diet. Puree diet was very pre-made, so that didn't count.
Right.
And she tasted it, and we know how it tastes. We know how it's supposed to go down our throat. She goes, "You're right." I'm like, how'd you do it? I'm like, and I train my guys how to do it that certain way. You have to follow my instructions when it comes to these specialty diets. Regular diets, I can let you slide a little bit. But big thing I tell all my guys, follow the fucking recipes.
Yeah.
Do not, if you don't have something, don't act on your own. Come see me first.
Right.
The only time is sometimes if you don't have replacement, like you don't have real onions, you can use onion powder. That's a
Hmm.
replacement.
Hmm.
If you don't have neither, you don't put it in. That's the worst case scenario.
Right.
Like,
Gotcha.
like sometimes I had to tell my guys, like, we have no liquid eggs. Yeah, we do. They call crack them and whip them.
Yeah.
I have to crack all 400 eggs. Like, yep. Start
Yeah.
cracking. I'll be out there in a minute to help you.
Right.
Like, I'm pretty fast because I can use both hands,
Right.
But something like they're like moaning because I want to do this. Like back in the day, they didn't have liquid eggs, so what the fuck, bro?
Yeah. Yeah.
Yeah, and they actually put cream in their eggs, actually in healthcare,
Mm.
not milk.
And,
Heavy cream.
and what is that for? Just to give them a little extra caloric content or make it more
A little
nutrient
more
dense?
calories.
Gotcha. Yeah.
That's
Gotcha.
what it is,
Gotcha.
man.
Yeah.
Exactly.
Yeah. That was always the thing. I wanted to kind of go, just kind of get that a little bit because again,
From my
here
understanding,
it's like running. Yeah.
from colleagues I spoke towards New Jersey, New York area, they're still doing the old school way. Now, if you come towards my area, they're focused on is like smaller pocket areas to up the food here first. Then they're going to start moving towards the bigger towns and cities.
Right. Right.
Because the food has gone from here to here.
Right.
Like,
So the quality's definitely increased. So that's good to know. I mean, at least if you're going to be paying that kind of money and whatnot,
Yeah. Let me show you another picture. This is a healthcare pictures again.
Okay.
This is when I was in one of my nursing homes. Let me see a decent one. All right. I'm gonna share my screen right about now. I'm gonna show one. I'm not gonna go
Okay.
crazy.
Okay. Still waiting for it to come over. Got it.
Yep. This is healthcare now.
Nice.
That's what you get. Collard greens with a nice piece of chicken and
Some potatoes there. Yeah.
Yeah. They're called potatoes because they're little small ones, and they're just easier to work with. This is the way we're going now. And
see if you can do, I mean, that would really,
this is how we go. Garnishes are starting to get involved. People just, one of the problems with people, forget, you don't eat with your mouth. You don't. That's the third thing you eat with. You eat with your eyes and your nose first. And people look at me like, "Are you serious?" Like, yeah. Because let me ask you a question. Paul, the gyros we went last year, you looked at it, it looked really good, right?
Yeah.
It smelled really good, right?
Yep. Everything was, it was on point.
It's awesome, right?
Right.
How do you eat now?
What do you mean, how I eat now?
Now, you said it looked good. You ate with your eyes first, right?
Well, probably my nose first because we were walking towards the
Okay,
I didn't see them until we got them. So the nose was probably first.
Yeah.
And then I saw with the eyes, and then I enjoyed the mouth.
So the mouth was the third thing you
correct. The third sense that I actually got the taste was the thing. Yeah.
The way I worked in office buildings with Compass Group, and people go, "Dude, looks good. Like, I can make you one." Like, yeah, can you? I'm like, smells good too. I'm like, well, yeah, I make it, of course.
Yeah.
Throw my little jazz in there.
Yeah. And that has so much to do with wellness. I've been I know people in the hospital, they would not eat unless you brought them in something off the street. It's like if you brought the McDonald's. So again, you would always ask the doctor first, hey, look, if I went and got some KFC or some McDonald's or something like that, can I bring it in? Again, depending on what it is. I mean, if you just got like an arm, like a broken arm or something like that, you can eat anything you want. If it's
that actually.
Right.
Yeah, they're really starting to push back on that now because what happens, you're bringing outside elements into the hospital. Because hospitals be very controlled. They're a lot of places are starting to push back on that now. Like coffee is just for one thing. That's okay.
Right.
But food, they're getting very strict with that. Like,
no.
Yeah,
I haven't noticed that yet. But I can understand why. But again, I think it depends a lot on the injury. Like if you got like internal injuries or something like that, where again your diet has to be controlled. They're like, if you're there because you got a broken foot or leg or something, something like a compound, they're usually not that hard on it. But I know people that they're very finicky food for that reason. Now, again, if you're going to start making food the way you just shown it, then I can certainly see people coming back and being like, okay, I can stomach this. But in fact, I just saw someone in the hospital a few weeks ago, and he was like the same thing. It was like, there was like a Wendy's and whatnot across the street. It's like unless you brought that stuff over, he didn't want to eat. I mean, he was a finicky guy anyway.
Example, bro.
Yeah.
So you remember a few months back, my mom had COVID. You know what I mean? If you remember that.
Yeah.
So she was allocated at my old hospital.
Mm-hmm.
I really don't know the management because there's a new company that manages them.
Mm-hmm.
But obviously Mariana still works there. I got on a fucking phone where I raised up, what the fuck happened to my kitchen? She goes, this kitchen has gone upside down, Pete. Like, it's like, what happened? Like, so I sent her pictures. The pure, she was on a mince and moist diet because of her teeth issues.
Mm-hmm.
So I go to her like, this was dry, it was burned, it was disgusting. So which one do you want to do? You get a survey, you put what you want down there, and I fucking let them have it. And the next day, because I knew the VP still at the hospital, I gave her a call. So he goes like, you need me back, but you don't want to pay me what I want. She goes, you're 100% right. And we do need you back. But unfortunately, the food has gone down so bad right now. It's not even funny.
Yeah.
Because of the company. Right now they have Sodexo in there. Sodexo is one of the worst companies to work for. Like, if you hear Sodexo, run the other way. Literally run the other way. What the fuck? You and Krispy Kreme, Eric.
Yeah, he's not a fan for whatever reason. But wanted to take it back, I guess, more to the healthcare. So again, obviously that's a piece of it in terms of the food piece of it. And again, now I don't even know what they're charging for those foods. I don't know if you have any
I do.
Inside in terms of the cost, again, relative to, like, say, going to a restaurant and getting a meal.
$50 to $60 per plate.
$50 to $60 per plate.
It depends. It doesn't matter what you have.
You're talking about a high-end restaurant. Like, I can go to New Brunswick right now to a high-end or whatever and spend. In fact, my wife and I's favorite restaurant is an Italian restaurant called Girasole's, and we'll pay that per person for a gourmet meal at a restaurant. And in a hospital where the food generally, and again, I see what you're saying as far as they're trying to up the game and up the scale a little bit, but to pay that kind of money for a meal where the chicken's undercooked, the veggies are overcooked, the bread is stale, and the food overall is unflavorable, and you're still spending $50 to $60. Again, this gets back to, again, the costs that are exorbitant. $10 for a Tylenol, $50-$60 per meal, and the meal is, you get a bologna sandwich with with a carton of milk and maybe some Jello, and you're spending $50-$60 for that. Again, that's the problem with the healthcare, just the industry overall. Everybody's making money hand over fist, and again, you're not getting good value for the money that you're spending in the healthcare system.
So one of the biggest problems also in the healthcare is the chef, the executive chef, EC, we call them. All right, the EC. If EC doesn't give a flying fuck, your food is gonna look like shit. Like, for great example, I just had this conversation with Mariana a couple days ago. Actually, today, her chef doesn't give a shit. He wants to say, he goes, "Oh, I got a conference call every hour." I'm like, the fuck? I've been a chef. I have never seen conference calls that much in my life. So you can sit there and say how you may get 1 or 2 a month as a chef, but you know what? Because they are leaning with us chefs, so you're really not supposed to be on your phone in any food handling and stuff,
right?
But because we have to be in the kitchen hands on, they tell us, hey, if you got AirPods, just put your AirPod in and go do your work and be in your meeting at the same time, and it's fine. So most chefs don't give a shit because in healthcare, they go, oh, it's a desk job. That's why they call these chefs desk chefs, or because they're lazy.
Yeah, they're just administrators. They're not
doing shit.
Yeah,
because the hospitals run 2 different ways with the workers. One way is you bring an outside company to run the kitchen, and the workers are employees of the hospital. The other way is all their employees are from a contracting company like Sodexo, Compass, Airmark, and so on and so on. So they're so they have no rights in the hospital. They're guests there technically. So and that part of it is because I guess they're saying, I don't give a shit. I get relocated. That's the worst case scenario, and that's the wrong mentality to have. I have issues with my guys when they do that to me.
Gotcha. Let's move it back. We got about 30 minutes left in the show, 25 minutes. So I wanted to steer it back to something that, congrats, appreciate Craig, certainly joined the network. We appreciate you being here, and again, welcome aboard. And we got Lost in Translation also in the building as well. So again, I always appreciate you being here. One area that I think when we talk about healthcare in coverage is covered services and medications. Now, again, certainly, one of my daughters, she's had, various, just allergies and just different things that she's had to maintain over time. And there's always the fight that when she calls up and says, okay, she puts something in and she asks the question, she gets the reply back saying this isn't covered. And then she has to, even though the doctor is saying, yes, you need this, but there's always that pushback. So a lot of times she has to go in and ask the question, why isn't this being covered or whatnot, having to go back and forth. So you got to get the doctor involved, or the doctor tries to explain it or something to that nature. But they're always trying to find something, or it's only going to be covered up to a certain amount. And so for those in the chat, if you're dealing with if you've had to deal with that, the idea of fighting for your coverage, and what did you have to do if the insurance company was like, we're not covering that, but you ultimately did get it covered, how did you go about doing it? Because I think that is something that seems to be a strategy, and certainly a mindset that you got to be diligent on and fight them tooth and nail. But it seems like that's like the biggest hassle that I see a lot of people. In fact, I've seen it even in my family having to deal with. And then sometimes it's got to go towards a board. It has to go to some kind of review in order to get it or whatnot. So my daughter, there have been times she's had to fight very hard to finally get it. So when she did get it, it was like tears of joy when she finally was able to get what it was that she was able to get. So I'm just curious, certainly for those in the chat, if you've had to have those kind of battles, you're on the phone for hours at a time with a correspondence between the health, the insurance company and your health provider and whatnot. What were some of the things that you did in order to overcome that scenario, or what would be some recommendations that you would offer and suggest for people if you're going through those battles? Because again, I think BM, you said it earlier, I mean, there's so many other things that are covered, surprisingly. Some cosmetic surgeries are covered by private insurance, but other things are not. Certainly certain eye companies, for example, most of them still don't cover LASIK surgery, even though it's gotten a lot better over the years. It's a lot safer procedure over the years. But again, they would rather have you in glasses and contacts and prescriptions. But a lot of vision companies still don't cover LASIK, for example. So I'm curious about curious about that. So I just want to put it out to the chat. If you've had to do a battle, don't share any, again, personal. I understand HIPAA laws and whatnot. You don't have to go into detail about anything specific. But if you could just talk generally about how you were able to overcome those battles with the insurance companies on things, I'd like to hear it. Go ahead, B.
One thing I want to touch a small base, because two things I want to touch base is, one is with the plastic surgery. We have all these transformers getting all the surgeries, and we were paying for it for the longest time. Too recently, they just reversed that law finally, and I'm glad they did, because that is not something, plastic surgery, I don't think is something you should be worried your insurance will cover for. Like now, if you need, for example, my mom needs eye surgery, that is something serious. My mom needs, her teeth done, that is something serious. Cancer, something serious. Something like that. Yes, I understand that. But now, when they were, the government was paying them to get their, they're changing their, from female to male, whatever the case is.
Mm-hmm.
The second thing I want to touch base also too is the VA. The VA does not have great insurance. It's getting better over the years, but the VA it's pretty bad, believe it or not, for the veterans. Like, I remember me, remember Angry Elf from my network.
Yeah.
He was saying that if you don't follow up with these guys to the T, you have issues.
Yeah.
Like even Bossman, I was on the phone with him a couple months back, and he was, he wasn't feeling well. He called the VA and says, I'm not feeling good, blah, blah. I don't get too much detail to put his business out. They approved him to go to a local hospital because the VA was too far from his house.
Right.
So those are a few cases like that.
Yeah, I
So
mean, it's a catch. I mean, we know a lot of guys. I mean, Mandrell. I mean, we know so many
right.
guys, part of the BMU family and beyond. Part of the military. That still use the VA. I mean, I think VA seems to be a good option just for general medical situations. But I think maybe for something specific, then I think you get into the battles. I think you get into the fights and whatnot when you need specific services or whatnot. For a specific need. I think that's where it kind of, it can kind of get a little bit contentious as far as, getting access to those. But most of these guys, they still go through the VA. I mean, it's not like I don't know any military guy who does not use the VA. Generally, or to say, look, I'm totally out of it or whatnot. They still rely on them because, again, relative to getting private healthcare insurance is still a much cheaper option than going with a private insurance carrier. So for all of its flaws and whatnot, and I'm happy to hear that it's getting better. Certainly, it's still a valuable resource for most veterans, unless you're someone who if you've done very well for yourself in the private sector and whatnot, you can you can get the Cadillac type of plans and coverage that you need and whatnot. But again, for the general population of vets and ex military, VA is still going to be probably their number one option overall for most of their coverage, unless they they get married to someone who works in the private sector and they're able to get private sector insurance. But those fights can really I think that's where a lot of the stressors come in. I mean, so one, you're already sick or you're already battling something, and you have to again be on that phone. First, to get help. A lot of times, even you're on the phone for an hour, waiting for someone or whatever, and whether or not the person knows the proper procedure. Oh, you got to fill out this form, you got to make this request or whatever. You go back and forth. You put your work in. You find out 2 or 3 weeks later, you're still suffering whatever it is that you're suffering with. But again, you got to wait it out until you get the the letter back saying, okay, yes, we've agreed to the coverage or whatnot. But again, those are the last things you need to be worrying about is can I get coverage for things that are, again, we're not talking about cosmetic. And again, we're talking about things that, again, you're under care of a physician. The physician is making a recommendation in terms of what you need, but again, you can't get those things. So again, we talk about the good and bad and the ugly. I've seen a lot of ugly battles when people have to go before these boards or reviews or whatever and try to get, access to things while they're still try to keep, because I think mindset and stress, again, those are things that can exacerbate symptoms when you're going under something. So to try to keep you cool. Now, again, a loss, he talks about patient advocates, certainly those can certainly be resources that you can use when trying to, kind of get that, try to get that coverage, so again, but where people go, and that's the thing, how, the process by which, how does a person find one, and how do you get into, there's different, groups, or there membership fees, or there's different things that you do to do that. That might be something maybe we want to do maybe in a part 2, and maybe certainly, Loss, you can certainly share some resources in terms of, how to reach out and contact these patient advocates and what they can, what they
from
can do
my
for you in those times.
experience through the hospital, the patient advocates can only do so much.
Mm-hmm.
Their powers are very, very limited. You are the one who needs to follow up and do your part of the job too. They'll give you all the information, but they only give you the information. If you don't do all that, your legit work, you're just wasting time.
Yeah. And then you have to also have people, I mean, if you are in fact the patient, so let's just say you are in the hospital, again, who do you get to advocate from a personal perspective? So whether it be, a loved one, a close relative or whatever. Again, I had to be, obviously I was, power of attorney for my mom, and I was her healthcare, healthcare directives or whatnot. Everything ran through me. So I had to certainly educate myself on a lot of things in terms of not only the prescriptions that she was on, but the procedures that were being done. And more times than not, I had to kind of sign off on those things. And it got to a point where I was like, when they were talking about further surgeries, it was I who had to basically say, no, we're not doing this again. And that was certainly after consultation with the rest of my family. I kind of explained to them what the situation was and whatnot. And, is this worth continuing just going, even though her symptoms were getting worse and worse over time? And so, so certainly having somebody in your corner who can really do that kind of advocacy for you is certainly one of the benefits of family. Because again, I would hate to think at some point, like, because you got to start thinking about that for yourself, Pete. I mean, you're relatively, healthy now, but again, in 20 years, who's going to do I have to come and bail you out? if you need that, I'd be there for you, but I'm just saying, but again,
Probably.
those are things you have to, be mindful of.
Honestly, that's one. I've been thinking about this for the last couple of years. So it started and I told you in private conversations about my ex with
Yeah.
all the marriages, and that's one. And it came to my mind, like, okay, she has kids. I don't have any. I don't have cousins. I don't have brothers. I don't have sisters. Like, something that happens to me, I am fucked. Like, yeah, I got CQ who's 3.5 hours away, but he has something else to worry about. He has his wife, and I'm like, I can call you, but if you're available, you might tell me, dude, I am in the middle of work. I can't just get up and leave. And I get that.
Yeah.
So when it comes down to my emergency contacts, I really put NA down. And they're looking at me, you really don't.
Wow. Yeah.
I don't, bro.
Yeah.
Like, I'm flying solo here. And it scares the shit out of me sometimes because something.
So does that then, not to switch gears too much. So in terms of your relationship goals, does it therefore become not so much a romantic matter, but does it become a more practical one?
I think it's 50-50 at this point.
Okay.
I really don't know. I literally had this conversation with a lot of people. I literally had this conversation today when I was so I went to church today, and like I knew we would go on Sunday. And I went back about 20 minutes later. I came home to walk the dog, do my thing with my mom, and I went back in my work clothes because I helped them prep out the Greek festival on. Funny fact is on Comic-Con weekend, on whole weekend. I'm like, son of a bitches. But then it's scheduled.
Thanks, Father Casadino.
Yeah, it wasn't him. Actually, it was the board of church who did it. I looked at
okay.
Church. I'm like, what? But anyway, so I was prepping, and we were having this conversation with the guys. It was like, and it was just guys cooking, and so like, and he goes like, don't you think it's more practical? Like, I explained to him how I feel, and my determination has been, again, it's still the same. Like, as I said, 50% is practical and 50% is romantical. Because if it's not if my lifestyle or my beliefs are not fitting into that, it's not practical. She's not gonna have my back. It's not practical. If I'm not gonna, her family's not gonna become part of my family too. It's not practical. But if I'm not attracted to a person, like, what's the point then? You know what I'm saying?
Well, look, I mean, attractiveness is going to fade over time. I mean, it's like, it's those are calculations that you need to make. If someone's going to be, if someone's going to be there for you no matter what, you're in the hospital, whatnot, you can't, represent and speak for yourself or whatnot, but this person is willing to take all these things on. Then again, how much does looks or attractiveness really mean at the end of the day when you're talking about, and again, we're all going to get to a point where we're going to be old and shriveled up and no one's going to care about attractiveness.
So I will give you that. Attraction is not everything. And I don't always go for the outside. I believe attraction is two different ways.
Right.
The outside and the inside. I need the inside to match my wavelength, if that makes sense. So if that connects me, if we have a connection where we're feeling good, great, blah, 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 okay, great. Then I don't give a shit about the outside. You know what I'm saying? I do care at a certain point, obviously. You know what I'm saying? And like you said, that does fade over time. But I need to have that, the connection with that person. That's more important to me.
Yeah.
And that goes back into the connection is part of the romantic, and then goes into the practical too.
Right. Because I see a lot of people, especially these, I mean, we all know, we see in the trend lines, you have less people getting into relationships. We have fewer people who are getting married. You may have children, but again, if you're in a position where you have young children, can you even afford to have something happen to you? Which is why I'm always an advocate, don't have kids before marriage, because again, you're gonna, it's worse when you have to go through a sickness and illness, and you have dependent children who you also have to be worried and concerned about. So again, getting a partner, now whatever you want to call it, partner, husband, wife, spouse, whatever whatever situation that where somebody who can really be there for you when you're in a situation. Not everyone has that advantage, especially like in your case, you don't have siblings that could certainly do that for you. So for you, marriage may become much more of an essential or necessary item for your own sake in survival, versus just somebody who just wants all the situations, all the stars have to align before getting into the situation. It's like, look, as long as you can get into a situation where you two can be there for each other and whatnot and commit and dedicate to that, that might be your best insurance policy, if you will. Forget the what healthcare coverage you have, unless you have someone who's advocating for your well-being, which is, I think, certainly what the role ultimately of a spouse is. Is to make sure someone who takes after you, is interested in your best, taking care of things in your best interest. Then I think those are things that they're missing. But for a lot of people who are trying to do it single, it's those are things that you have to start considering, because again, anything can happen to us at any given time, and that's not to certainly scare people and whatnot. Again, but life is a risk. And either you're gonna risk in this life alone, or you're gonna risk with somebody who is gonna take care of you, or at least be concerned about you to make sure certain things are in order. So again, who you hook up with, somebody who has the competency to do those things, is also important. Because I know when I was taking care of my mom towards the end, you realize that not everyone is competent to handle certain matters.
That's correct.
So again, who is really going to be who's going to be, really doing that for you? Being married is a very big job that you don't get paid for. That is true, but it may pay off in the long run again when you need it. You know what I mean? So again, it's definitely one of those things that is to consider. If you don't want to call it marriage, if you want to do partner, whatever domestic partnership, whatever you want to do, certainly those are things that can really benefit you when you're in a health related situation. You need someone to speak and do things for you that you can't do on your own, because again, you're in a hospital, so you can't go out and do all these other things that need to be done, because you got to be concerned with your health care up front. But I would be interested in again, certainly the chat is open. If you've had to really go through those battles with insurance companies to fight for the coverage that you needed, and whether you got an advocate for it, certainly I would love to hear a case of someone who was able to do that, or just through your own persistence, and what were some of the things that that you made sure that you did. I think certainly some practical steps is I'll always document, call, time, place, who was the person that you talked to at the time, who was the person on the phone that you were talking to. Make sure you follow up on the days that you followed up. If they said, well, you'll get a letter in 5 to 10 days, make sure you follow up on that if you haven't heard from them, certainly in a given time. And but if anything, just try to manage your stresses while you're going through that. But I've seen what that can certainly do to people, and just not just your health wise, but just your overall outcome. When you need certain things, it can really depress you when things that you thought were going to be there for you, you're paying the money and whatnot, and it's just not there. So I mean, healthcare in America, we're starting to put the landing gear down and try to land this plane. But yeah, I mean, healthcare, especially in the U.S. So again, I don't know if people here, if you're for some sort of universal healthcare coverage, if you still think the private sector is still the best way to go. I think regardless of what you deal with, unless this government is really going to get serious about taking profitability out of healthcare, I think that's always going to be a deeply political issue. But do understand there's going to be winners and losers in this thing, and who do you want to be winning? Pharmaceutical companies, they have an agenda. Medical Supply companies, they have an agenda. Hospitals everyone has an agenda, and everyone's trying to make a profit more times than not at your expense. And as a nation, we have to start having more conversation about, what do we want? And then if you hear the political rhetoric on whatever side it's on, try to have an understanding of, what's driving that talk, who's going to benefit from that discussion. And again, just looking at the cost that we still spend to this day, we still spend less than 1% of our GDP on healthcare. So then, the idea that, if you went through a universal system or whatever, that'll bankrupt the country or whatnot. Again, make your own conclusions based on the research that you do, but always factor in who benefits from one system working or another. And at the end of the day, is it going to be the citizens of the country? You are the taxpayers. Are you expecting more out of your healthcare system? Do you expect more than what you're being given? And if you're not getting what you think you deserve, then what are we, as a nation of people, what are we willing to do about it? Now, it's obviously in this capitalistic country also, you have a choice. You can certainly, make as much money as you can so that, you don't have to rely on a government intervention or whatnot, but again, we know most people can't. But certainly if you can get yourself in a situation where, money is not an option or is not an issue for you, then certainly by all means do that. But, so as we start to wind down the show, what are your thoughts overall? Because I don't think I asked you that. Your just thoughts generally on a universal type of healthcare system. Do you think that this country is truly ready for that or will be ready for that in the near future?
I think
we're overdue.
Way overdue, because a lot of these arguments we have in our, I hate to say this, I don't want to start up any harness nest towards the end of the show, is a lot of political arguments is over healthcare.
Yeah.
So if we limit the stupidest fight in the world and take care of our people, a lot of these fights won't be there anymore. Eliminate the poison, you eliminate the problem. Simple.
Yeah. I mean, it's especially with a lot of the uncertainty, and obviously again, economics draw, but we talked earlier about, what happens when you leave a job or what happens when you let go. A lot of times the only option that you may have is COBRA or some other option. Now, again, some areas, there's clinics, there's health clinics. I mean, certainly the one thing I have seen exploding in recent years is the local clinics. The local stops and little mini bars where because again, if you go to the hospital for an X-ray, it's $100 minimum.
What I seen is still in this area.
Whereas if you go to the urgent meds or whatever, it's a lot cheaper. You're good.
Yeah, up here I seen a lot of express cares coming blowing up here.
Yeah. So, I mean, it's definitely it's shorter wait times. Most of them do take most insurance that you have, but again, if you did have to pay out of pocket, it's cheaper than going. Like I said, ER trip is $100, no questions asked. So so certainly I'm glad to see that. Certainly in the New Jersey area, there's literally just a handful just within a 5-minute drive from my house. There's several I have options to go to. When I if I did come down with C19 or whatever, I was able to just go to a place and get tested or whatever I needed from those places. So I can't remember the last time I actually had to go to be admitted. Certainly in a hospital, and I'm knocking on wood there. Very, very happy about that. But an urgent med or like I said, the sort of pop up places or whatever, those are certainly becoming options that people can certainly lean on, and they are needed. And again, there's places in the country just like you got food deserts. There's also medical deserts. I mean, where you have to drive long distances to get the service if you live in a rural area. So again, such places like that certainly could be godsends in those particular, areas where there's lack of it. Yeah.
Because when I first moved to this area, I lived in Mount Pocono. So the only option was at a time before Lehigh Valley took over Pocono. It was called Pocono Medical, it was a private hospital.
Right.
So that was one option. That was about 30 to 40 minutes from my house. Or the other option, I could the opposite direction. I could go to Scranton to Geisinger, and that's another 45 minutes either way.
Yeah.
So I was screwed either way.
Yeah.
If I go left, I was screwed right. It was going. Now they're actually opening more hospitals close to Mount Pocono. So now it's going to be only 10, 15-minute drive for anybody who lives in that area.
Yeah. 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 Again, controversial subject. We don't necessarily have the, the answers for that. Again, there's pros and cons across the board when it comes to it. But again, I think if I had a, certainly my closing would be as best as you can. Because again, Braxton, you're absolutely right. You can do all the right things, eat all the right foods, get in the proper amount of exercise, and you can still get sick, or you can still get into an accident, or So again, no one is going to be spared in this world from everything. There's no guarantees in this world. You can still find yourself in a situation where you're going to be in the healthcare system, but certainly do your best to live a healthy lifestyle. So again, you mitigate the risks that happen with that. But again, there's always going to be risks. Certainly do your research if you're shopping for healthcare. Certainly find out what options are available to you. So yes, so check the government plan, check your employer's plans, and do some shopping, do some comparisons, have the facts and figures in front of you, and see what's going to work best. Your family, and what if you have a family, what are the needs of your kids. Find out what's covered and what isn't. If your kids need certain drugs or medications or whatnot, make sure you get with somebody who's going to cover those things. It may cost you a little bit more, but again, you got to make sure that you take care of those who are there. But until this country decides if they want to do some sort of universal option and whatnot, and again, I think get the monetization, get the profit motive out of healthcare. I think you have to stay diligent about that to make sure that you're not, going broke. But I have seen, certainly, especially with older people, senior citizens and whatnot, a lot of them, you worked hard your whole life and whatnot, but again, health situation that can wipe out your what you've been saving up for the whole time. And so, so this is going to be an ongoing discussion in this country in terms of what do we want and what is going to be a benefit to more people. But I just think that, again, a healthier society, one that doesn't just treat sickness but promotes wellness and good habits, I think we'd all be better off. So, but with that, we're going to wind down the show. We appreciate you guys for being here tonight. Again, make sure as you leave the show, make sure you hit the like button on the way out. Make sure you go to the Sparta HQ Network, hit the like button. It's there as well. But until next week, in fact, I may not be here next week because, again, I'll be in Grenada. I'll be coming back that night. If I get in early, Pete, I'll let you know regarding the Gray Area show. Otherwise, I think you may have another co-host. But I'll definitely be back the week following, and we're going to be talking about energy in the next show. So, again, another political pipe bomb that we like to explore.
We might actually speak that for in the next weeks because
for the interview. Okay, so we'll, stay tuned for for upcoming programming. But energy is definitely on the docket.
What the plan is supposed to be, and I have one confirmed. One is I gotta speak to them. So for next week, it's a question mark. So stay tuned, guys. I'm gonna work on something on that. And on the 5th, was it? Let me tell you right now. Give me 1 second. Get my calendar up. Oh. On the October 5th, I was right. No, you got not. Yeah, okay, October 5th. I was right. October, we do have a guest. His name is Steve. He goes by the name Mayor. He was one of the biggest YouTubers of beer contacts out there. He was a teacher. Now he's a beer. Social media financially. So he has a roller coaster of life, and he's actually a really good guy to talk to. And I think it was a great opportunity to have him up here, have a conversation with him.
Gotcha. All right, guys. Again, thank you for joining us again for myself and for Sparta.
It's Sparta!
This is the Gray Area. You guys enjoy your week. Take care. God bless.